Good afternoon and welcome to the October 12th GMC membership meeting. I'm David Lubar, Chair of the GMC and CEO of Lubar & Company. As we all know, Wisconsin is experiencing a huge spike in COVID-19. The governor has extended the mandates, and although we all wish and want it to go away, we need to continue to be careful and vigilant. For today's program, we will hear from leaders who are dealing with the impact of the pandemic on their businesses, their employees, and their corporate culture. Many businesses, retail, hospitality, and entertainment in particular, have been severely impacted. Hospital ICUs are filling up in the Fox Valley. And in addition to the pandemic, many in our membership are grappling with how to support racial equity efforts and provide a diverse, equitable, and inclusive corporate culture. The GMC specifically is reviewing its policies, programs, and strategies to ensure that they are well aligned with DEI efforts. The GMC also will be launching a racial equity book club this week. If you are interested in signing up for the book club, please reach out to Heather Pahacek at the GMC. I'd also like to note that today is Indigenous Peoples Day and acknowledge that Wisconsin, the land that we live, work, and play on, was once inhabited by a variety of Native tribes, the Potawatomi tribe being the most prominent today in the greater Milwaukee area. We pay tribute and respect to all the tribes for this land and the historic names of the cities and towns in the region. Before we get into today's program, we have two guest speakers. First, I'd like to welcome Ian Abston, co-founder of the Home Group, who along with Michael Hosted, the director of the GMC's Commons program, led the multi-year effort to light the Home Bridge, a project that is just now being completed. The pair are teaming up again as the GMC and the Home Group host Forward 48, a civic leadership development program. Forward 48 utilizes best practices in engaging experiential learning and utilizing community leaders' insightful stories to create hands-on leadership development for Milwaukee's next generation of leaders. Supporting leaders in the first cohort include Betsy Brenner, Mike Lovell, Dr. Jeanette Mitchell, Rolando Rodriguez, Rich Musin, Bud Seelig, Thelma Sias, and Greg Wesley. These leaders will provide connections, leadership skills, civic involvement opportunities, and networking. I'd now like to turn it over to Ian to formally discuss Forward 48. Ian?
David, thank you kindly for the intro. I'm coming to you live from Wauwatosa in what is my new baby's bedroom, so I don't quite have the David Lubar sweet bookcase behind me, but there's lots of baby toys all around me. So, Forward 48 is going to be the best 5 minutes of your day. Michael Hosted and I learned a lot when lighting up the Home Bridge. And it was an experience that we over the last 3 years, learned more than we could have ever kind of known about how the city operates civically, professionally, how connections work, et cetera. And we wanted to take that, bottle it up, and share it with the rest of Milwaukee. Next slide, Meow, please. So let's go back in time. Let's look at a young Thelma Sias, a young Mike Lovell, who accidentally got something on his lip there, because I know that's not a full mustache, and a younger Betsy Brenner. These people, their age that you see right now, had so much potential, but what if Milwaukee didn't leverage it? What if Thelma did not go on to become who she did within the Democratic Party or within We Energies? And what if Mike Lovell didn't go on to lead two of the most prestigious universities in Wisconsin? And what if Betsy did not lead the Journal to win multiple Pulitzers along the way? What if these people and their talents weren't fully leveraged within the community? Next slide, meow. And a young Rich Musin, that would be his Tinder dating profile app if it were today. A young Jeanette Mitchell. Without these two, we wouldn't have young minorities in Congress and running for office. We wouldn't have the World Water Hub. And of course, there's a young Bud Selig who looks just like today's Bud Selig, but without him and his efforts, we would not have a professional baseball team today. And just like you're looking at these 6 people that we know as leaders today, we've got hundreds, if not more, in Milwaukee that are just like them. They've got the potential, and we need leadership pipelines established that can work with them. Next slide, meow. So forward 48. Here's what we've identified as the 2 problems we're running into right now. Civic succession planning. Currently, all the leaders within the GMC in this room, they've got career knowledge that they've gained along the way. But how do you actually pass that down? Bud Selig wrote a book. Most people don't. How can you create all of the items you've learned, building your personal, professional, and civic career, and bottle that up and hand it over to the next generation, these damn millennials, in a way that they actually want to consume it? That's podcasts, that's 1-hour-long presentations. And the next piece we've understood is emerging leadership development. We're not great at identifying the next generation of leaders, and we're probably mildly terrible at identifying the next generation of diverse talent and then keeping them here in Milwaukee. And that's what Forward 48 is here to solve. Next slide, please.
So Forward 48 really is a program, to David's point earlier, that is bridging that Milwaukee leadership gap, and doing so in a way that tells the stories of current leaders in Milwaukee, so that we can start to build that civic succession strategy that's going to define Milwaukee's future. A little bit more about the program, again, is presented by the GMC and the Hone Group and facilitated by the Commons. So it is a talent development program. It is a virtual program over 8 weeks, taught by a subset of Milwaukee's current leaders, and it's limited to 48 participants. We're looking, by the way, for young people. These are going to be age 25 to 39 that care as much about becoming leaders within their company or their organization as they do becoming leaders within their community or their neighborhood or their region. We're looking for the next you on this call that can learn and grow and become civic leaders here in Milwaukee. The program runs on Wednesdays, starting the day after the election, and it's no secret that Thelma Sias is our first presenter, so it's going to be a good first session coming hot off the election, and then ends December 16th. Participants will earn master's credits at Marquette University. Thanks to a great partnership there, students will earn potentially up to 4 master's credits in either an MBA program or a master's in public service. They'll also get a 3-month print to digital subscription to the Milwaukee Business Journal. Next slide. So as David mentioned, these are our faculty. We're incredibly proud of them all and that they have agreed to do this with us in this pilot cohort. We've been meeting with them at length to identify the stories that they're going to tell and tie them into the leadership principles that will apply with the participants and the students. So thank you to our faculty. And again, if you're interested in being a faculty member in a future cohort, please reach out to me. Heather will have that information. Next slide.
So finally, here's the ask. What we're looking for GMC members is to look within your company. Find 2 or 3 people between the ages of 25 and 39 that you think would be on the fast track to be the next you. So here's the cost. Then we're looking for volunteers for the next cohort. Help us spread the word. All information is on Forward 48. reach out to Michael or I. And as a special thank you to all GMC members, next slide, please. We would love to invite all GMC members to a safe, socially distanced launch of Light the Home. October 22nd, 6 to 7:30 p.m. We've got both an in-person option and a socially distanced option for your family in the car. So these will be coming out from GMC, and we want to make sure all GMC members are given this invite. We'll have a special section set up for you, and special shout out to Ted and David and Greg Marcus for being on the board and helping us get this project done. We're looking forward to a brand new skyline.
Okay, thank you, Ian. And Michael. And I'd like to now turn it over to Julia Taylor.
Yeah, for some reason my my video doesn't want to start. So here we go. There we go. Thank you. Well, thank you, Ian and Michael, for your commitment to creating this new strong leadership strategy for Milwaukee. And congratulations, Ian, to you and Jackie as well for the birth of Bo and your new stage in life here. We're excited to work on Forward 41 with you in the home group. This presentation is a great segue into how the GMC is focusing on innovation and talent. During the pandemic, the need to connect talent with leadership growth opportunities is more challenging than ever. And the Commons has a solution to this disconnect with a virtual career accelerator. It's a fast-paced career development experience designed to help talent explore career options and make professional connections. So we're seeking a diverse group of students to participate in this first ever program, and all areas of study, ages, and backgrounds are welcome. The GMC initiatives have experienced great success with the virtual accelerator programs, including Scale Up Milwaukee, which is in the middle of a virtual Spark cohort. It's a business accelerator working with women and businesses owned by people of color with less than $1 million in revenue. We have 27 companies ranging in industry from floral design, legal, professional services, and they are all striving to grow their business by an ambitious 44% over the next year. The Spark program includes instructions in sales and marketing, organizational development, operations and finance, and digital acumen. This approach has led to Spark's alumni's inspiring growth stories. So we look forward to this cohort's future success and all the growth stories to come. And the Milwaukee United Displacement Fund is ready to launch the second year of the pilot program. The fund supports long-term low-income households that are homeowners in areas seeking indicators of displacement in our greater downtown. In the first year, 88 homeowners received property tax benefits from the fund. If you're interested in joining members who have supported this great effort to enable homeowners to stay in place, contact Milwaukee United Director Tony Ponsiera. We would also like to thank Renee Hersing for donating marketing resources to the Milwaukee United community organizations to assist in their digital marketing strategies in response to COVID. And I would now like to introduce Dr. John Raymond, the President and CEO of the Medical College of Wisconsin, to share the most recent COVID updates. Welcome, Dr. Raymond.
Thank you, and good afternoon, Julia, and hello, everyone. I hope that everyone's doing well. As David Lubar said earlier in the webinar, Wisconsin was the epicenter of COVID-19 in the United States last week. And as of this morning, according to the New York Times, we still had 3 of the top 5, 5 of the top 10, and 10 of the top 20 metro areas in terms of new cases per 100,000 over the last 2 weeks. And out of the top 10, that we have Oshkosh, Neenah, Appleton, Green Bay, Manitowoc, and Sheboygan. And the others in the top 20 include Wausau, Weston, Marinette, Beaver Dam, Fond du Lac, and Platteville. So looking forward, though, only 2 of Wisconsin metro areas are rated as having the fastest rises, and those are Wausau, Weston, and Janesville, Beloit. So with some luck, we will reach or have reached our peak. So let's start with a summary of testing data. If I could go to the first slide, please. Next one. Cumulatively, we've tested about 1.7 million people in Wisconsin, and nearly 300 of those have been tested in the Milwaukee area. We just eclipsed 150,000 positive tests or COVID-19 cases in Wisconsin since the beginning of the pandemic, with 31,529 of those in the Milwaukee region. As of yesterday, we had 10,247 tests reported. That's a little light compared to most days. And I do want to draw a distinction about tests administered and people to whom tests have been administered. We usually have about twice as many tests reported as people tested reported. So on average, it appears that many people are being tested more than once. And this would occur for a variety of reasons, such as frequent testing in congregate living situations, schools, and frontline healthcare settings. And as we know, some people are tested multiple times early in the course of their disease because of severe symptoms or to confirm resolution of viral shedding near the end of their disease course. So reporting cases rather than tests is the most appropriate public health metric. But because of concerns expressed by the MacIver Institute in late September, DHS now reports both, as well as positivity rates calculated using both cases and tests reported. So our testing capacity has increased. Now it's at 43,234 tests per day, with 117 laboratories now testing. Now, if we could shift to the right side of the slide, daily positive tests have been trending unfavorably in Wisconsin for the last month. And yesterday, there were 2,676 new cases reported in Wisconsin and 338 in Milwaukee. Now, the Wisconsin number is the highest ever reported on a Sunday. And in Wisconsin, daily cases have exceeded 2,000 19 times and 3,000 3 times over the last 26 days since we first exceeded 2,000 on September 16th. The previous high of daily positive cases in Wisconsin was 3,338 on October 8th, and in Milwaukee, 477 way back on May 29th. Also, the average case positivity rates over the last days in Wisconsin and in Milwaukee were very unfavorable at 19.6 and 18.7% respectively. These are too high, and they suggest that there's a significant burden of undiagnosed COVID-19 cases, both in the state and in the Milwaukee area. Next slide, please. Now, this slide shows various indicators. We've had 8,398 admissions of COVID-19 positive patients to Wisconsin hospitals since the beginning of the pandemic. And as of yesterday, there were 889 patients in Wisconsin hospitals with COVID-19. This is a week-over-week increase of 175 inpatients. Now, our previous high was just a few days ago at 907 on October 8th. And just for reference, our low was 235 back on July 5th. There's also a similar trend with COVID-19 ICU admissions. Wisconsin reached a new high census of 235 yesterday. And not surprisingly, ICU bed availability is decreasing as COVID-19 cases increase. And there were 234 beds immediately available yesterday, compared with counts of close to 400 that we were enjoying back in August. Now, on the good news side, though, ventilator capacity is copious and should not be a limiting factor for caring for COVID-19 and other patients. PPE supplies also have improved, but the supply chain remains fragile and we can't take it for granted. Next slide, please. Now, hospitalizations are rising in all 7 Healthcare Emergency Readiness Coalition regions, so this is a statewide problem. And COVID-19 hospitalizations are at or near all-time highs, with exponential growth for all HERC regions over the last 10 days. Fox Valley has 131 hospitalizations, North Central 112, Northeast 143, Northwest 43, South Central 111, and that includes Dane County, Southeast, which is our region, 316, and West with 33. And COVID-19 ICU admissions are rising in 6 Healthcare Emergency Readiness Coalition regions. COVID-19 ICU admissions are at or near all-time highs for the state and for 5 HERC regions, including the Fox Valley, Northeast, Northwest, South Central, and Western. And ICU censuses are high in 6 of the Healthcare Emergency Readiness Coalition regions, including Fox Valley, North Central, Northeast, Northwest, South Central, and Southeast. And you can see the percentages there on the slide. And ideally, ICUs work best if you have less than 70% occupancy. I must clarify that most of the patients in these ICUs don't have COVID-19, but a surge of COVID-19 patients requiring intensive care places a strain on our ability to take care of all of our patients. And indeed, Madison and the Madison area health systems are considering reductions in non-emergent care right now. Now, the Southeastern HERC, including Milwaukee, shows that hospitalizations are rising and ICU admissions for COVID-19 also are rising, but we're not at the highest levels that we experienced in early April. But we do need to watch out for a boomerang from other regions of the state because the virus doesn't stop at county lines. Now, a couple of points about hospitalizations. I want to make sure everyone understands it's not easy or practical to move patients between hospitals, even in a geographically compact region like southeastern Wisconsin. And this is especially problematical in rural areas. There's a risk to transport personnel, it's inconvenient for the family, and it consumes healthcare resources. And I would also say that it's easier to create surge capacity in regions that enjoy large tertiary and quaternary care settings, like here and in Dane County. And next slide, please. This next slide just shows some statistics and some indicators. Currently, in Wisconsin, we have 78.7% of patients who are listed as recovered. Now, recovered means they're no longer shedding virus, but it doesn't mean that they've fully recuperated or that they've returned to their pre-COVID-19 state of health. 19.3% of the cases are active, and this is increasing as you would expect when we've had a surge in cases. Our case fatality rate is 1%. In other words, 1% of the patients diagnosed with COVID-19 since the beginning of the pandemic have died. And we expect that when all is said and done and we're on the other side of the pandemic, the ultimate infection fatality rate, that would include people that had COVID-19 but maybe didn't have a positive test, is going to settle in at about 0.6 to 0.7%. We've had cumulative deaths of 1,465 in Wisconsin and 438 in Milwaukee. And as I've said before, COVID-19 deaths disproportionately affect people and communities of color, but can be fatal for anyone. And as you can see, the majority of deaths in Wisconsin are among people who self-identify as white. And this is particularly important when we think about the spread into rural areas. Now, the doubling time for positive tests has begun to move unfavorably. It's now 43.6 days in Wisconsin and 84.8 days in Milwaukee. The 7-day growth rate of positive tests is flat or stable at 1.8% in Wisconsin, 0.9% in Milwaukee, and the reproductive numbers remain above 1.02 in Wisconsin, 1.08 in Milwaukee. Now, these numbers have been at or over 1 most days since the beginning of September. Next slide, please. Now, this next slide, I'm just presenting this to illustrate that deaths lag new cases in Wisconsin by about 4 weeks. And this goes along with the experience in other countries and in the rest of the US, where deaths seem to lag 4 to 5 weeks after the cases surge. And we've seen this throughout the pandemic. However, it's interesting that deaths have not increased proportionately to the new cases, unlike earlier in the pandemic. And this is due to multiple factors. I think that these include a more coordinated public health infrastructure, better testing, protection of people in congregate living and close work situations, better supportive care, moderately effective therapeutics, and the impact of community face coverings. I want to talk about that just briefly. There's a new emerging idea that in addition to reducing the likelihood of spread of COVID-19, that masks or cloth face coverings also reduce the dose of virus or the viral inoculum so that people who do get infected might not be as sick. Now, we've not yet seen a clear increase in the COVID-19 death rate in Milwaukee, as shown on the right, and we hope that we won't. But as you can see on that graph, we're now at the end of that 4-week lag phase. So the next few days will be important. Next slide, please. This slide is similar. It shows that hospitalizations and ICU use lag the increases in new cases by 2 to 3 weeks for Wisconsin on the left and southeastern Wisconsin on the right. The red vertical lines are provided for your reference just to show you the beginning of the increase in new cases in Wisconsin on the left and in southeastern Wisconsin on the right, so that you can see that the lag between cases and ICU use and hospitalizations is somewhere between 2 to 3 weeks. Next slide, please. This slide is only shown for your reference. It includes the data sources that we at the Medical College of Wisconsin use for data presentations. I want to thank all of you for your attention and your leadership during these challenging times, and I'll turn it back over to Julia.
Thank you, Dr. Raymond, for your continued leadership, guidance, and advice. That was a very sobering report. There were some tidbits of good news, but otherwise, our state's been going in the wrong direction, but hopefully we've reached the peak and we'll be headed in the right direction going forward. I'd now like to introduce Kim Stoll from Badger Meter. She is chair-elect of Milwaukee Women, Inc. Milwaukee Women, Inc. was created to help companies achieve a balanced representation of men and women on boards of directors, which statistically has shown to lead to improved business results and performance. Each year, we invite Milwaukee Women, Inc. to share their annual findings. So welcome, Kim, and we look forward to your report.
Okay, great. Well, thank you very much, everyone. As David said, my name is Kim Stoll, chair-elect of Milwaukee Women, Inc. I'm also the Vice President of Sales and Marketing at Badger Meter. I'm very excited to be able to be here today to share with you the progress that we've been making. So the presentation today will offer a brief overview of Milwaukee Women, Inc., highlight our latest research, and offer suggestions on what you can do to increase the number of women in C-suites and on boards. So for those of you that are not aware, Milwaukee Women, Inc. was founded in 2002 by a group of Milwaukee business women professionals really interested in furthering the discussion about women on boards of directors. Our mission has really remained consistent: to achieve balanced representation of women on boards of directors to maximize the performance of Wisconsin businesses. Our goal is achieving 25% women directors in the top 50 Wisconsin public companies by 2025. Okay, I'm trying to switch slides. There we go. Okay, thank you. Okay, so I'm happy to report that, as I mentioned before, the percentage of women on boards continues to increase. Last year, our research focused on the power of three. Really, the idea that research has found that women need to hold at least 3 board seats to create a critical mass, which can then lead to better financial performance and create an environment in which innovative thinking and ideas can spring from gender diversity. Now, this slide shows that there is a decrease in the number of Wisconsin companies with 3 or more women directors from its high in 2019. This decrease, however, is largely because of women board members who have retired in this year. If we go to our next slide here, this slide really is highlighting some of our key findings. So if you look at it, you can see that 21.1% of board members are women. That's up from 20.8% in 2019. We've also seen an increase. 8% of companies have 4 or more women board members, and that's up from 6.7% last year. So we've been seeing progress there on the board of directors front. As we all know, the funnel or the pipeline for board members really is the C-suite. So we also look to track the number of women executives in the Wisconsin 50. The numbers of women in executive ranks on the good front, good news, are also increasing. 21.9% of company executives are women. That's up from 21.2% last year. And 36% of companies have 3 or more women executives, which is up 5.6% from last year. So again, we're seeing progress in moving the needle. When looking at gender diversity of Wisconsin top 50 companies compared to the S&P 500 companies, Wisconsin is trailing by about 5.4%. However, the good news is that Wisconsin continues to see year-over-year upward progress. The percentage of board seats held by women, what our research really has shown is that we're seeing that consistent growth, and we want to ensure that we continue to see that growth. This slide here is really a list of Wisconsin public companies that have 3 or more women directors on their boards. And those highlighted in orange, Alliant Energy, First Business Financial Services, Manpower Group, and Sensient Technologies, actually have 4 or more women. As I mentioned earlier, 8% of the companies have 4 or more women, and this is up compared to the 6.7% in 2019. We're moving the needle. CEOs and boards are making a conscious decision to really diversify their boards. And I want to recognize 9 Wisconsin public companies who have elected women to their boards over the past year. Enerpac Tool Group, Exact Sciences, Fiserv, Generac, Manitowoc, Martin, MGIC, Sensient, and WEC Energy Group. So congratulations to these companies and of course to these women that now hold a seat on these boards. While the needle is moving with increasing women on boards, what we are still seeing is that there are too few women of color on boards. When looking at Fortune 500 board seats by race and gender, fewer than 5% of those board seats are held by women of color, yet they represent 18% of the US population. And what we're also seeing is that white women represent 17.9% of these board seats. And 66% of the board seats are held by white males. So what can you do? I think my slides here are stuck. Well, what can you do? As CEO Tim Matkey from MGIC Investment Corporation stated, make a conscious decision to diversify your board. It's the right thing to do, and it sets the tone from the top down. Other things that you can do to increase diversity include pushing for a diverse candidate slate, widen your net to recruit a diversity of skill sets, similar to the skill sets that are required to run a business, to run the company. Ensure that your board members adequately represent stakeholder interests, and look to expand the resources and networks that you use to reach your diverse candidates. And that really leads me to how MWI can help. MWI is dedicated to advancing inclusive leadership. We're connecting CEOs, nominating and governance chairs, and search firms with our networks of women, our database of steering committee members, and best practices. We're here to help. I encourage you to reach out to our website. We have an executive database that consists of many women in southeastern Wisconsin, executive women that potentially are excellent candidates for board positions. They're also a good resource for helping you to network to identify additional potential candidates. So again, please go out and visit our website, and we're here to help. Any questions, any thoughts, ideas, that you might need. Our organization is here to help and looks forward to continuing our engagement with the business community. Thank you.
Okay, thank you, Kim. Thank you for your report and for your continued work. So for today's program, we have invited 3 women and 2 men to GMC members to serve as panelists. And they will share how they are supporting their employees during the pandemic and this period of social change. Today's pandemic climate has increased the stress, pressure, and uncertainty in our businesses and the lives of our employees. Many factors, including work from home, managing daycare, balancing personal, family, and business duties and responsibilities, and the uncertainty about future employment and compensation impact our employees and their productivity and physical and mental health. So I'd like to introduce our panelists. Grady Crosby, Vice President, Public Affairs and Chief Diversity Officer of Johnson Controls and President of the Johnson Controls Foundation. Amy Lindner, President and CEO, United Way of Greater Milwaukee and Waukesha County. Chris Miskal, President and CEO of Versiti Inc. and the Blood Center of Wisconsin. Lee Riley, partner, Foley and Lardner, and Peggy Troy, President and CEO of Children's Hospital of Wisconsin. So, panelists, I have a series of questions. Some of them have multiple parts to them. So, you know, I'm asking you to answer all parts, but do the best you can. And not everyone has to answer every question. So just kind of self-select as to what you think is most relevant. But I'd like for the first question, of course, to address COVID-19. And as we heard from Dr. Raymond, COVID-19 continues to cast uncertainty over our economy's strength, particularly for the hospitality, entertainment, and travel industries. Hiring, training, and retaining employees has been a high priority for companies for a long, long time. For those of you whose employees are not working remotely, what's your experience been with morale and safety? And for those of you whose employees are working remotely, and I understand many of you have both, what are you doing to keep them engaged in your corporate culture, keep them bonded to each other, keep them productive, and help them with potential mental stress issues? So maybe we'll begin with the hospital. Peggy, how's that?
Great, thanks. Thanks so much for including me today. And I want to give a shout out to Dr. Raymond for all the great advice he's given us related to the seriousness of COVID-19. He's kept us up to date, really reviewing all the data and the analytics so we make sure that we're making really good decisions. So yeah, we're in an interesting business in the midst of COVID. One of the great things we have at Children's is we already had a very strong culture that we began our culture work back in 2011, and we really focus on transparency and collaboration. When we think about our values of purpose, collaboration, integrity, health, and innovation, each one of these had to come to life in the COVID world, as you can imagine. We had to deal with whatever was coming our way, and so we just had to really make sure that we were doing all the right things to embrace this culture and accentuate it. You know, one of the things that we talked about initially is that, and one of our themes is the strong leadership shadow that we all carry as leaders. And how we react is where employees really take their cues and clues. And so we had to be very intentional about that. And the other thing is that we really had to promote the well-being services that are available to our staff, because we were expecting them to be in the forefront and to take it on for whatever came to our way, and to make sure that they were equipped to do that. And you can imagine the very beginning, It was really uncertain. There was lots of uncertainty in this unprecedented time. And we realized one of the most important things that we could do was really communicate early and often. So when we first became aware in early March that this was really serious and we had to take this very serious, and we did not know how it was going to affect kids or how it was going to affect our workforce, we set up an incident command system. So what we did is we asked our medical college faculty, our primary care physicians, our nurses, our pharmacists, and our infectious prevention people, our finance people, across the entire organization to really rally around how we could use the expertise of each one of those and make the very best decisions we could for the organization. So we really had to think about, all right, what were our strategic priorities when we began the year in January? How are we going to really retool those? Because all efforts, all hands on deck had to be really focused on how we were going to deal with COVID. We added leader meetings, first via phone, but then had several Zoom calls, which we've all gotten very used to. And we've increased the employee and provider sections on our internet and our emails. Initially, we did them daily, sometimes 2 or 3 times a day. The communications team was right on our side with all of this. And to make sure that we held virtual town halls so people could get their questions answered again. And then a lot of what we did was intentional rounding. I myself went out to the different areas with my N95 to talk to people to make sure that they really understood that we were taking this very seriously and that our first and foremost effort was really to protect them in the workforce. And really that helped a lot because people really appreciated the fact that we were out and about. Again, so many of the things that were causing stressors in people's lives, we asked 1,000 people to work at home, just like that. They had to go home. But we also had to think about, what about childcare? What about back to school challenges? What about all these things that employees were facing? So we developed leader toolkits to make sure that we could preserve the well-being of our team and that they could be at their best when they had to take care of families. We shut down our services like we were asked to do, like many others. We realized in early April we were losing about $1 million a day in net revenue. So that was particularly sobering. But we made some really good decisions on the front end. And one of the most important decisions we made was not to furlough. And I think that did so much to reduce the anxiety, because what I realized is at any point in time where we were going to expect people to come back to work, we had to have the best workforce we could that felt really good about their employers. So we asked people to take, their vacation time. We developed a labor pool and had as many as 75 or 100 people a day in that labor pool. And we had nurses and others that would go to sterile processing and housekeeping, environmental services and others, just to make sure that we could keep our business going and again, deal with whatever came. We really talked a lot about how to stay safe at home. We provided new child care support options and then really went into virtual learning. And then one thing that I've done since day one is really encourage on our value of health, our wellness program, and to make sure that people felt they had the permission to take care of themselves. We did video yoga breaks and Zoom support groups and all sorts of things to make sure that, again, people access. And of course, our EAP program was incredibly busy because, while a lot of us are just pick yourself up by the bootstraps and just deal with whatever comes in you in healthcare, we really needed to do that. And then the last thing I'll say is that, we also decided to move forward with our mental and behavioral health strategy. We launched our Shine Through campaign. I hope you've all seen that, where it really is talking about how we preserve the mental and behavioral health of people and, most importantly, reduce the stigma. So many different aspects, pieces and parts. I have a great leadership team that really stepped up, but in the end, we just had our employee engagement surveys and we did well, even in the midst of all of COVID. So that's where we're at today.
All right, Peggy, thank you. Well, so I'm going to go around on my screen, and Chris at Versity, what's your experience been?
Yeah, thanks, David. So I'll focus kind of on the first question. I think Peggy said a lot, and it's good to know that we're thinking about some of the similar things around how we lead our workforce through what's been a horrific time. What I'll just say is that information is so critical, and I know it sounds very obvious, but particularly when people are disconnected physically, because we had a combination of essential workers that had to be in hospitals, some of our physicians that are helping from a blood standpoint, being integrated into the hospital systems, they have to be there. The folks that are doing our lab testing, they have to be there. People collecting blood, they're essential, they've got to be out there. So we did have this dichotomy of folks that were out versus folks that were fortunate enough to be able to stay back. And kind of managing through that required a lot of communication, repetitive communication in different forums, because we've got folks working across 3 shifts, across locations, and sometimes you just have to hear the message multiple times. We did pay premiums at the beginning. For some of the folks, there were certain roles that we determined a pay premium was relevant, until we kind of got a couple months into it and we started to figure out that in some cases, the environment that we're creating when we're out there because of our safety measures, arguably safer than being out in the general community. And so at an appropriate time, we peeled some of that off. But we spent a lot of time talking to our leaders about what your interactions look like with your staff, because there's only so much we can do centrally, but really it comes down to that one-to-one connection. And so through our management meetings where we touch 200-300 of our leaders, we would start to talk about things that seem simple, but like, what does the one-on-one conversation look like? And really taking the first 5 minutes of the one-on-one to ask people how they're doing. And they may give you the generic, I'm fine, but pausing to say, no, really, how are you doing? And there were a series of kind of double-click questions to make sure that people were able to just get out what they were feeling. Because in some cases, just being able to say it made folks feel better. But we also learned nuggets in there where there were things that we could react and respond to. And then 2 other things, and I'll let others jump in, is that recognition and a culture of gratitude is super important. Some of the bigger companies may have had these for years, but we recently, within the last 12 months, developed a program called Versity Celebrates, which is one of these online tools where peers can recognize each other. Those things are so good for culture in terms of being able to give folks kudos for the hard work that they're doing. And then our leaders are able to actually share points through the system that folks can use in an online store once they accumulate those to buy different things. So we really focused on culture and normalcy where we could. Our annual service awards we've continued to do. Normally those are in person and they're super fun. Well, doing your annual service awards remotely, it requires a little bit of different thinking of how do you tell the stories, how do you bring it to life? And so we've been able to do that in a way where I think it's really engaging for folks, and you see the chat feature kind of blowing up in Zoom when we do our annual 5, 10, 15, up to 40-year service awards. But I think it's being thoughtful and intentional about how you make people feel good and continue to think about all the reasons why they bought into your organization in the first place.
Hey, very, very insightful. Thank you, Chris. Lee, what's happening at Foley and Lardner?
So at Foley, we're doing a lot of very similar things that Chris and Peggy talked about. We're about 25% capacity in the office now. We have made it completely voluntary. So if you feel like you want to stay home, you can stay home. If you want to come into the office, you can. Subject to, we've got about a 25% cap on who we want in the office. As far as safety in the office, you know, if you're not in your office, you got to wear a mask in the hallways and in the restrooms. We have hand sanitizers about every 3 feet. You know, paper towels, so you don't have to touch doorknobs if you don't want. So we've certainly made our office experience incredibly safe. As far as the well-being, we've done a lot of the things again. We've brought in some mental health professionals to give special training to leaders, and talking a lot about what Chris said. When you have those one-on-one conversations with your staff, you know, our specialist said, don't ask how you're doing, ask specific questions. Are you getting your work done? Are you struggling to get work done? Are you stopping working? I mean, you can imagine as lawyers, we just need a phone and a laptop to get our job done. And what we were hearing is when everybody was working from home, there wasn't that dividing line of getting in your car and driving home. And people were just not ever stopping working, which was going to lead to burnout. So we actually had to encourage people, please stop working, please take some weekends off. And they needed to hear that from the leaders to be comfortable with that. So that's been our challenge. The other thing that we're doing is, and we were doing this a few months, we have a new wellness initiative within Foley about mental health well-being, and we were doing internal blogs where people could share their mental health stories or their wellness stories. And of course, we pivoted a lot of our blogs to talking about how we're dealing with the pandemic and how we're dealing with working from home, and having kind of some of the leaders within our firm share their vulnerability and say, we're struggling as well, really went a long way.
Very insightful. Thank you. So Grady, you're at Johnson Controls, the biggest company represented here, biggest in the state. What's happening there?
First of all, thanks, David. Thanks, Julia, for the invitation to even be present with you all here today, to be able to present. Everyone has done just a fantastic job. You've kind of summed it all up and talked about all the great things that are going on, and nothing dissimilar is going on at Johnson Controls. So as Chris mentioned, it's good to know that we're in great company and we have great leadership all over that is providing these resources that our employees vitally need. I think maybe, the one unique perspective for us, as you mentioned, David, having about 110,000 associates over 150 country footprint, we were in it from day one. We started this back in 2019 when our associates were involved with the issues that were going on in Wuhan, China, and started to set up the auxiliary facilities and remote hospitals to support COVID infections, and setting up HVAC systems to be the centerpiece of infectious control systems for not only in the APAC region, but as the pandemic spread for different countries alike. And so that insight gave us some very unique perspectives in terms of, how to take care of our number one priority, and that's our people. Our people and our customers were always number one. And so we made sure that we took those learnings from those experiences that we were having across the globe, even before the pandemic began to really hit the U.S., to make sure that we were implementing some of these safeguards as broadly and as quickly as possible. So as was mentioned about the face protection and the social distancing and the making sure that there was great hand sanitation going on. These were things that we implemented really quickly and really immediately. And as some have already talked about here, we certainly have a mixed workforce where everyone could not work remotely. And so so for those that were in the office, we needed to make sure that primarily their needs were taken care of. They were going to be safe. We instituted some of our own technology around thermal recognition cameras and that nature to make sure that we had access controls addressed so that those that were symptomatic, we could limit exposure in the facility. We had tracing and tracking in place so we could see where there were clusterings going on in the office to make sure that we were using space, and space utilization planning was being optimized so as to prevent any spread in the office. We certainly were not immune from having COVID cases and even COVID fatalities within the Johnson Controls family. I'm just very grateful and thankful to say that none of it, as far as we know, was the result of anyone being exposed or infected while at work. And so while we grieve with a number of our families, we've tried to make our facilities as safe as possible. Now, for those that are working remotely, as people have said, we've done all those things that have literally been mentioned. So I won't go back through any of that. I'll just emphasize and say that we've asked our managers and people people that are responsible for people in our organization to really be understanding and to really be patient with people as they deal with the litany of things that were going on, from the fact that, you're working remotely and sometimes not very comfortable surroundings, to having to deal with childcare or even adult care issues, especially as people were going back to school, parents trying to, deal with virtual learning and things of that nature. We even provided some of the We even provided our employees, kids with JCI-themed activity books and scavenger hunts so that they could maybe sometimes integrate some of the things that their parents were doing with their own work assignments. And then we, from the communication standpoint, which again is just very critical during this time, to continue to embed our values and talk about, and somebody mentioned, I think Peggy talked about the culture work that started at Children's Hospital. If you didn't start it before now, you really were in trouble, because it's really hard to launch culture work in a virtual environment. And so we were also fortunate to have started that work as well. And so this environment has helped us in terms of just trying to emphasize and embed that into our people through a new methodology such as perspective sessions. So we had our leaders come together and host sessions with our employees through team live events. And the perspective may have been from a father's perspective. We've had perspectives from our young professionals. We've had perspective sessions with our ethnic minority groups. And we've also, speaking of that, really tried to leverage our business resource groups as communication threads as well. We've relaunched our business resource groups through this process to make them even more global and not so locally based. And again, emphasizing the fact that everyone needs to not bury their heads in the sand, but to really have a good understanding as to what people are going through and be patient with our employees as everyone deals with real life. I'll say that we've been good on the front end of initiating those conversations. We still have work left to do on the back end about keeping those conversations going and doing the necessary follow-up. So I'll stop right there, David.
Okay, thank you, Grady. So Amy, the United Way, tell us.
So much of what people have shared, especially about communication and transparency and authenticity, prioritizing our teams, making sure we know how they're doing, has really resonated. Same stuff we've been working on and thinking about and implementing at United Way. I can say, we're in the part of our annual calendar where it's the most stressful, hardest part of our year. We're halfway through fall campaign. And so this every year is a tough time of year. So right now in the COVID time, this is a heck of a stress test for us on whether we put the right things in place to keep people well.